we explain diabetic macular edema. Meet Joe. Joe was diagnosed with diabetes 3 years ago. Since then, he's had to make changes to his lifestyle. Joe has been bombarded with information about the ways his diabetes could affect other aspects of his health. There are literally hundreds of sources, from leaflets at the clinic and hospital to entire websites devoted to the issue. Joe can't possibly read everything and finds all the advice overwhelming. Due to this information overload, Joe has missed some important stuff. He may not even know that he could suffer vision deterioration or even loss if he does not manage his diabetes properly. Vision impairment due to diabetic macular edema, or DME for short, is one of the leading causes of blindness in those suffering from diabetes. DME is a consequence of diabetic retinopathy, the most common diabetic eye complication. DME can lead to significant visual impairment in up to 3% of patients with diabetes. Sight loss is the most feared diabetes-related complication. DME occurs when tiny blood vessels in the eye begin to leak fluid. This fluid causes swelling in the central portion of the retina, or macula, which makes vision blurry. Sufferers may also experience image distortion, color or contrast changes, floaters or dark spots in the field of vision, called scotomas. It's important to remember that these symptoms don't just happen overnight. It's a chronic condition that can take years to develop. For someone like Joe, visual impairment can hugely affect his everyday life, from managing his diabetic medications to preventing him from being able to drive or even work. And if left untreated, he could even lose his sight. Joe should visit his ophthalmologist on a regular basis. While there are treatments for visual impairment due to DME available, the best form of prevention for Joe is to manage his blood sugar levels carefully and effectively. Pay attention to other risk factors such as his diet and weight, and of course, take regular cardiovascular exercise. If Joe begins to experience any of the symptoms of visual impairment due to DME, a retinal specialist will be able to recommend the right treatment for him to ensure Joe retains a high vision-related quality of life.